Calling all Swifties and champions of change, Like a Girl Media is rolling out the red carpet for you with our Thrive Like a Girl contest. We're all about celebrating powerful women leaders who inspire us to dream big and push boundaries. And who embodies that spirit more than Taylor Swift herself? Here's your chance to see her live in concert. We're giving away 2 tickets to Taylor Swift's show in London on Saturday, June 22nd. Imagine being part of the magic, all thanks to Like a Girl Media. Entering is easy. Subscribe, share, and show us which episodes inspired you the most. Visit our website or check our social media for all the details. Don't just dream it, be it. Thrive like a girl and make this summer unforgettable. Contest opens globally, void where prohibited, must be 18 or older to enter, no purchase necessary. Subscribe and share with hashtag Thrive Like a Girl and tag us at likeagirl_media for entry. Unlimited entries means unlimited chances. Winner chosen at random after contest closes May 20th, 2024. Will be notified via DM. Make sure your profiles are not private. Check full rules on our site. This is your shot to see Taylor Swift live. Don't miss it. Hello, and welcome to the Hit Like a Girl podcast. My name is Joy Rios, the show's host, and today we are embarking on an exciting journey through our new 5-part series focused on Techquity, which is the intersection of technology and health equity. In this inaugural episode, I am thrilled to welcome Janna Guinen from the Health Foundation. Janna is at the forefront of this initiative, advocating for equitable digital health solutions that cater to the needs of underserved populations. Janna, thank you for joining us today and help us unpack what Techquity actually is, why it matters, and what we can look forward to in this series.
Thanks, Joy. I'm really happy to be here to kick off this series of 5 guest episodes focused on Techquity and healthcare, each of which will feature we'll feature 5 winners of the Techquity for Health case study competition. And just to set the stage, so Health Foundation is a nonprofit organization, and we're focused on 5 imperatives for sustainable and ethical healthcare, which are access, affordability, equity, inclusion, and innovation. And technology, when you think about it, complicates all of these variables in healthcare. So about a year ago, the Health Foundation started the Techquity for Health Coalition. And as a coalition, what we're really trying to do is help the industry understand and manage these factors so that we can have greater success and consistency in addressing health disparities through digital health. I mean, technology can be like the hero or the villain, and it needs to be at least a good supporting actor, in the story of health equity. And that's why we started the coalition. So, and then very specifically, the coalition is working on defining best practices and recommendations, and also looking at metrics that we can use for digital health equity, again, or Techquity. Before I go on, I just want to take a second and give credit and say thank you to the organizations that stepped up and supported the coalition from the very beginning, before it was really anything but an idea. So big thanks to the American Medical Association, Amazon Web Services, Epistemics, Outcomes for Me, UST, also the National Association of Community Health Centers, ResMed, Empirics, VSP, Global Innovation. We've had some fantastic support to get off the ground. And also, I have to just give some credit to our dedicated and really experienced group of advisors that are helping to drive this initiative, they've just been an incredible and valuable resource. And we have a lot of fun as a group too. So thank you to the advisory committee of the coalition. And then that brings us to where we are right now. The Techquity Coalition just completed its first case study competition, where last fall we put out a call for cases, and we're completely thrilled to get about 200 submissions from across the industry. It was one of the exciting things about this is not just the number, but the huge variety in these case studies. So across sectors, settings, technologies, just a great process for us to learn and to understand the landscape of Techquity right now. And in the end, we awarded 11 projects. This was at the end of February at the Vive event. We held an award ceremony. It was really, really fun. And then just to explain why, like, why did we do this? The whole purpose for this competition was to bring visibility to the best practices as they stand today, to kind of confirm our understanding of Techquity, of how health equity can really show up, when we're implementing or innovating in digital health, and then to look at novel approaches to Techquity in healthcare. And it really did give us some very interesting visibility into the landscape. So in each of the 5 episodes in this series, as I mentioned, we will feature one of the winners of the case study awards. They'll talk about their projects, the insights, what they've learned, and we'll have a guest host, a different guest host for each of the interviews, which are one of the coalition advisors. And this has been great because our winners actually, there's a sort of a relationship. We were able to find an advisor to conduct each one of these interviews who is in one way or another kind of connected to or doing work in a related area. So great conversations. So here's the final thing. In just a moment, you'll hear from our first guest, Anna Kravitz. Anna is the president and the co-founder of AdirA, which is a digital strategy consultancy. So she recently sat down with Andrea Werner, who is the chief population health officer at Bellin and Gundersen Health Systems and an advisor to the coalition. So I'll give you a little bit of background on what they're talking about here. So Anna and her team at AdirA were challenged by Merck to confront the issue of high mortality rates from breast cancer among Black women. And just, I want to share one statistic. Black women have among the highest incidence of breast cancer among women in the US, and women younger than age 50 are twice as likely to die from breast cancer as white women. So Black women younger than age 50. And also Black women have just a higher overall mortality rate just at any age from breast cancer. So it's a big problem. So Merck sought to enhance awareness and encourage earlier and proactive health screenings among younger Black women. Just, that's going after consumer behavior is one way, but, patient behavior, just make sure they understand the need and that they're able and know the resources to follow up and how it pertains to them. So what AdirA did, and their response was to develop NIA. And NIA is a digital guide that was created to educate and also to really provide genuine support to Black women, and it really resonates with them. You'll hear Anna talk about their success rates, like how long people stay and really do the consultations with NIA and different measures of success that they use. But in any case, this is an initiative that's really a standout example of how very thoughtful, targeted, and culturally relevant interventions can make a significant impact. So I'm excited for you all to hear it.
Wonderful. Thank you so much for all of that setup. And I can't wait for our audience to listen in to this conversation. So without further ado, let's dive in.
Hi, my name is Andrea Werner, and I'm the Chief Population Health Officer for Bellin and Gundersen Health System. And I've also had the privilege of sitting on the Techquity for Health Coalition for the last couple of years. It is a privilege for me to interview today Anna from AdirA Health to learn about wonderful work that she and her team are doing with a solution that is called NIA. For me, leading population health, it has become crystal clear for the last couple of years that the intersection and interdependency between technology and improving the health of our communities is so important. And a lot of the health tech companies that we are learning about these days are really existing to solve one problem or another as it relates to delivering on triple aim or quadruple aim or quintuple aims when we think about equity results to the communities that we serve. So Anna, maybe you can introduce yourself, tell us a little bit about your story and how you got started with AdirA, and then bring us into learning a little bit about NIA.
Thank you, Andrea. So my name is Anna Kravitz, and I'm a co-founder of a company called AdirA. AdirA was born out of the need to help people navigate the complexity of our healthcare. There is a lot of information, a lot of education, but what we decided to focus on is help people to take health action, because there's so much information people can drown in. So we are a consumer health action company. My co-founder and I started this company to really focus on helping people navigate the complexity of healthcare, but specifically help people deal with the mountains of information and come to what is absolutely relevant for them and can help them lead to the proper health action for themselves. So we started about a little over 5 years ago. We build a number of solutions, both for private sector and public sector. We build some of the platforms that we own that have not been sponsored by anyone, and always had health equity in mind, because we felt that health action has to be achievable for everyone in the country. So we're not just health equity company, but our health action is focused on delivering it for everyone.
So double click, if you will, on NIA, on the solution NIA. What problem were you trying to solve with NIA?
So when we looked at the issues that exist in breast cancer, it's a complex topic for a lot of people to navigate. But specifically, there was a much higher kind of barrier to overcome for younger Black women. I don't know if everybody knows, but for younger Black women, ages 25 to 45, so it's in this pre-guideline phase for a regular screening, such as mammogram, that population tends to have very poor outcomes. They're more likely to get aggressive forms of breast cancer called TNBC. They're more, almost like 3 times more likely to get that aggressive form of breast cancer. In addition to that, because they get it at the younger age, oftentimes when they turn to the doctor, what they hear is, you're too young to have breast cancer. The normal screening, it doesn't work very well because they have denser breast tissue. So because they are not being heard and for their issues, the outcome is they tend to be screened later, diagnosed later, and the ultimately younger Black women in that age group end up with 41% higher mortality rate from breast cancer than white women of the same age group. So what we wanted to focus on is to help younger Black women to understand signs, symptoms, and the risks of breast cancer for their population, and be able to advocate for themselves and start taking a more active role in their breast health. Things like self-exams, regular clinical checkups with their doctor. So when something starts changing, they can catch it earlier.
So the Techquity for Health Coalition has really been focused on thinking about technology that can equally distribute access to services, provide tools that are engaging and empowering to all populations. And one of the things that I loved about NIA, and one of the reasons why I scored NIA high in the ratings as a reviewer of these cases, is the fact that you co-designed the solution with people who have lived experience, experts who came from the community. Can you tell us a little bit more about that, Anna? Like, who did you partner with?
Absolutely. It takes a village to tackle difficult problems. First of all, I wanted to mention and acknowledge that the sponsor for Project NIA is Merck Pharmaceutical Company. So they provided sponsorship and thought leadership around the subject matter. Our expertise is health action. Our expertise is not breast health necessarily, this clinical domain. But to make sure it's clinically relevant, what we have done is brought in Black women's health imperative to really bring that voice of the community. So we worked with them to really zero in on that population. They helped us organize several focus groups and moderate those focus groups. Actually, the moderator herself is a Black woman who is breast cancer survivor. So it really helped to bring that relationship and with the women that were part of the focus group and make sure that they felt comfortable to speak up about their experience. We also worked with Black Women's Health Imperative to really set the direction for the visual design, both for the look and feel, the palette, the tone of the conversation, design of the avatar for the experience was very important for us, making sure it's someone people will find relatable, but at the same time, they can connect with that avatar that they're having conversation with. And Nia is the name of the avatar, and hence the name for the Project Nia. So we knew that we got the design right. One of the reviewers from the community saw it and said, oh, Nia looks like a cousin who made it, right? So it's like a cousin. Someone is from my community I can relate to, but at the same time, I can look up to them, so I can take their advice. In addition to bringing the cultural expertise, sourcing it from the community, we engaged with a clinical expert from the community as well. So the clinician with whom we developed the algorithm for the digital conversation, Dr. Christy Johnson, is herself a Black female clinician who practices in Philadelphia and sees the population. So we bring it both from the clinical and then the cultural, and we try to immerse ourselves as much as possible with the representatives of the community we're trying to reach.
Well, I have to tell you that I experienced Nia, and it was a really interesting experience. So I went out there and I found her. In the Bellin region, within our enterprise, we have a promise that we talk about, and it's, I will know you, I will show you respect, I will go with you on your journey, and I'm here to help you. And I honestly felt like that's what Nia was doing with me all the way along. And what was so interesting is that she would ask me questions, and I had to be honest with her about an opportunity I have to improve with self-breast exams. And it was so awesome because she did not make me feel bad about it. She framed it in a way where, well, great, like you could do better if you did this. She was instructional. I felt like she displayed empathy. And it was so fascinating. And she kept telling me that at the end of the experience, I would walk away with a personalized report that I could take with me on my own health journey. And I thought that was so fascinating. And all along, I could tell that she was designed in a way to meet people where they're at, not only culturally, but as unique individuals as we engage with her. And one of the outcomes that I'm really fascinated with the NIA solution is the amount of time that people are willing to engage with her. So Anna, my understanding, a really impressive outcome measure for NIA is that 66% of women who engage with her longer than 4 minutes, and 25% of people who engage with Nia engage with her longer than 8 minutes. For me, I found myself spending a lot of time with her, partly because I was a curious healthcare professional, but also because Nia was challenging me to be a better steward of my own health, and it was fascinating. But I think that that's an outcome measure that is truly impressive. What other outcome measures or measures of success would you highlight for us that you're proud of with NIA?
There are actually a few things. One, I would say, is just targeting, making sure that we get to the right people. Because how many young women that are otherwise healthy may not realize that they have this higher risk factor for breast cancer would want to click on an ad and talk about breast health. So making sure we're able to reach and engage young Black women was something that we were not sure initially we'll be able to achieve. But because we have this kind of continuous loop between our outreach campaign and data coming from that and the data coming from the experience, we were able to get a very, very tight targeting, and about like 60% of women that that come through the experience are Black women, actually young women who ages 25 to 44, basically sub 45. And we have another pretty good number of women in that 18 to 24 age group. Our experience is not under 18, so we politely exit people that come that are under 18. But that, like, think about that number of women in that younger age that are curious about that topic and starting to think about it early. So we definitely got our age targeting down, and then race also we're close to 80% with getting right race targeted. And one of the things is we definitely are not excluding anyone else, but young Black women first type of solution. It's mainly for them, but we have somewhere 16 to 17% of combined white and Hispanic coming to the solution, and they still get the meaningful experience, but they're not the primary audience. So definitely getting the targeting right, something that was pins and needles for us in the beginning, making sure that if we're trying to help this population, we're able to reach them. The second thing is the completion rate. We talked about how long women engage, but we also have this the benchmark for us, how many women who start the experience actually complete that. And there we are at somewhere for the life of the program. We launched late last summer. We somewhere around 16, 17%, but we are continue improving. So we're higher, but like the blended completion rate, which is 3 times industry average. And again, going back to the example I mentioned from the New York State WIC program, and that program is called Project Wanda. Wanda is sister of Mia. There was a concern if we're able to meet the industry standard of about like 5 to 7%, but we were able there to beat it and be somewhere around 15, 16%. So here we're doing as much, if not better.
It's so fascinating to me. I mean, in population health, we think a lot about really solving those last mile problems. What do we really need to do to reach everybody, to drive outcomes and impact? And what just struck me is that you're leveraging technology in the spirit of equity, and you're doing it by myth busting. Like you're creating a credible avatar, a credible experience. And you're busting the myth for these young Black women, and you're giving them the facts, and you're equipping them with tools and information, a report, a guide to do the right thing. And normally, these women may not have access to these types of resources and information. And you're creating a new narrative for the right thing to do for breast cancer in young Black women. It's really awesome. It's really awesome.
Thank you. We want to give them agency. We want them to be able to come, first of all, understand and take in that this problem exists, give them knowledge, give them tools, and give them resources to have that better conversation with the doctor. We're not there, of course, to replace the doctor, but we want to make sure when they go for those checkups, they come informed and being able to advocate for themselves. Because as I said, we heard the stories of women getting a long, windy road towards diagnosis, feeling something is off with them and not being heard the first few times when they voice their complaints, or sometimes even themselves not realizing that if I'm feeling something is off, it's important to go and get checked. But you would know that something is off if you know what the signs and symptoms are and what are your risk factors.
I love the thought of giving agency, and that's exactly what you're doing. Knowledge is power. Having someone support you, giving you information so that you can take charge of your health. I absolutely love that. I'm curious, what was your biggest surprise in all of this? Good, bad? What was the biggest surprise or biggest learning that maybe you didn't expect?
Yeah, that's a good question. The biggest surprise, we were a little bit, again, speaking of myth busting, right? There is this notion that there is a complete mistrust of pharma industry among patients, among the population. So we were not sure if our statistics of engagement and completion would be on par with our other solutions. We've built solutions for travel health, for contraception, for, as I said, this women, infant, children program, and we had very good engagement. But this time, it was very clearly stated that it's sponsored by a pharmaceutical company. And guess what? We meet the same levels of engagement, and in some cases even had better performance. And that speaks to, it doesn't matter who sponsor it. If you do it right, if you show through your solution that you're speaking authentically, you truly care about them, you treat their time with respect, and you treat them with respect, and you don't talk down to people, you don't judge them, and you give them something useful and relevant at the end, people will listen, people will work with you, people will take your advice and the information. So I think one example, again, going back to the solution that we have done for New York State, for Wanda, when we were testing, and that one was the person participating in the research or kind of giving feedback on the solution was a man taking care of the nephew and needed some support with nutrition. So went through our experience, called Wanda, came to the end of it and said, oh, that was simple. I got everything. It was quick. And you know what? It didn't make me think less of myself, right? Because a lot of time, even like in the sense of efficiency or getting to the point of things, people feel like they're being talked down, or it's some sort of going through the process type of experience. And it's hard for people to talk to another human at the time when they are vulnerable, they're not sure of themselves. That meant the world to us, right? It's those little comments, little remarks. And we spend a lot of time making sure we get the voice right, the tone right of that conversation, because each of our solutions has its own, a little bit of the personality, a little bit of fun, making a joke here or there. And depending on the topic, obviously we keep it within of what it is. But things don't need to be boring, right? Even when you talk about serious topics.
Absolutely. The Techquity for Health Coalition, we talk a lot about technology and the role in preventing further advancement of health disparities and closing the gap on disparities, and solutions like the ones that you're describing, where you do the research and you do the hard work and you get to know through voice and through data each unique population that you're serving. It just is so powerful. I think it's just incredibly powerful. And you're working with communities and populations who have had to struggle in the past, and giving support right from the very beginning with the solution based on research. And again, through collective voice and experience, I think is just one of the most powerful things in the space of Techquity. That's one of the reasons why you won the award that you did. Congratulations again on that one.
Thank you.
What do you look forward to next? Like, what is your next horizon with AdirA and with this great work that you're doing?
There are a few things. We're currently working on a few other solutions. Some of them are in oncology space as well. I cannot talk about the specifics yet, but once they launch, I'm sure we'll want the world to know. But, we're also looking to build solutions that are more open for broader collaboration and participation from the ecosystem. Because I think it's really important to, especially for those complex problems, for various organizations, whether it's public sector, private sector, academia, to be able to come together and leverage what was done by others and add on to their solutions. So think about we now have this great tool that provides that education and then personalized, curated summary of resources for women. Wouldn't it be wonderful to have other organizations that want to close the last mile of actually finding the doctor, setting up an appointment if someone doesn't have a doctor, or really. So one of the things we also always include in our solutions is social determinants of health, assessment of what gets in the way of you getting care that you want, that you need. Everything from transportation, childcare, work, and so on. There's so many organizations that provide those services. So being able to, at the end of it, to connect into all of that. So we don't just give like a summary guide with the resources at the end, but we provide integration. And we've done that for our health and travel platform. At the end, if a person is interested in, after we help them understand food and water safety, vaccines they need for the travel destination they're going to, they want to, we help them schedule an appointment for pre-travel health consultation. But that's the platform that we own ourselves, and there is no constraints of what can be sponsored by different sponsor. So we really would like to do more of those solutions that multiple parties can participate in. So we're thinking of applying for some grants so we can build those more solutions that are open for collaboration and participation for everyone who is interested.
So partnerships, I think, are one of the most powerful things in those of us and who are part of organizations and individuals who care about advancing health equity. How do you approach partnerships, or what are your thoughts on partnerships?
We partner as much as possible. One thing, or one guiding principles for us in AdirA is not to build anything that already exists in the market. And also strong recognition that we're not experts in everything. So we are self-funded, bootstrapped company. And from the beginning, we decided that technology-wise, there's so many technical platforms in the market. We'll find the right ones, we'll partner with them, we'll leverage it. And what we will focus on is what I have seen as a tremendous gap in the health IT innovation across the board, is coming up with really good use cases for various technology, defining your problem well, bringing the data that has the evidence that it's a problem, and having those statistics, because that helps you define a good solution that you can also measure. Are you making a dent by your solution in solving that problem? Number two, executing it with as much care, creativity, fidelity, cultural intentionality, focus on excellent user experience, beautiful design, good content. That's another piece, is a great execution of the solution to a problem, to the use case that is well defined. And then last but not least is operating it well, because oftentimes wonderful things are built and then they put out there, and if they don't get continuous care and feeding and looking at the data and feeding what you learn from the data back into improving your solution, or maybe modifying it to be a better solution, and using this data to identify opportunities for other unmet needs, and maybe either expanding your solution or building new solution. It's no good for anyone, right? Everything needs care and feeding. You plant a beautiful garden, if you don't weed it, it's going to go bad on you quickly. And because of that philosophy, we, wherever possible, we bring the right expertise. We're experts in defining the problems well, building great consumer health action solutions, but we're not clinical experts in any particular clinical space. As I said, we've done solutions, everything from nutrition to cancer to contraception to travel health. you name it. For those, we bring the right clinical expertise. And we typically work with people who are not just KOLs and focused on just like a high level thought leadership. We want people that actually work closely with the patients because our solution is patient facing, and we see our solutions as almost like an extension of that clinical capacity into the form of that digital conversation. So we can take 80% of the common topics or ways that this problem framed and exists in people and digitize that. So we bring in clinical partners, we bring cultural partners, depending on what it is. We work with outreach partners that have maybe a footprint in the community, or oftentimes when we do it for sponsors, they often have agency already doing digital outreach, but we engage with them in a completely different way that they've ever worked with anyone else, any other digital solution. We have weekly meetings with them. We compare notes of what we're seeing in terms of the traffic that comes from that outreach, how they're behaving. We're giving them that feedback. They refine their campaigns, their messaging, their targeting. We were able to make tremendous improvement from the initial start of those campaigns to how well they're performing ultimately when we get into a steady state. So we partner a lot.
And I love that you mentioned humility as the key to being a good partner. And I love that you gave a strong nod to quality improvement. I always say life and work is one big PDSA, one big quality improvement project. So when you think of the solutions that you have at AdirA, do you have a standard scorecard for all your solutions that you use and metrics that you look at across the different solutions? And do you have a common way of reporting those out to stakeholders and then improvement methodology that you use? Or how do you go about formally integrating that into your work?
Yeah, because we're very clear about what we do. We know the problem we're solving and it's data backed. And we know what health action we're looking to affect. Basically, between that sets the framework. So we know who we're targeting. So the first thing we always focused on, are we getting the right people who this solution is for? Because if we're not, we are spraying and praying. We are very specific about who we're after. And because we know what we're trying, basically for them to complete that experience, we're driving that to that point that we consider like a completer. There are certain milestones on the way to that. So every solution we built has what we call funnel, right? For people that come, and then what happens with them, like where are we losing them? And we monitor that and we adjust our solution, both from starting from getting quality input in, people who are actually this is for, and then delivering the right experience to them. So this is why we always very clear, like what we report on. Is our targeting on point? Is our completion on point? Are people engaging long enough to comprehend the information? And of course, with every solution, we ask for rating. So going back to Project NIA, I would say as last time I looked, about 84% gave a 5-star rating, and the 5-star and 4-star combined was 93%. So
congratulations.
Thank you. So imagine talking about not the most exciting topic of breast health for 4+ minutes, and then after that giving 5-star rating. It is extremely humbling for us, and we're grateful.
Well, congratulations on that. What are you curious about in terms of the next evolution of NIA? Do you see NIA evolving into doing even more in this space, or do you see NIA serving her purpose?
So one thing I would imagine NIA staying there for as long as she's useful, because there is always that next young generation coming in that need to be informed, educated, and activated to be serious about managing their breast health. But in general, what we try to do is what kind of like, why do we create experiences that we create, right? Those are digital conversational experiences that somewhere 3 to 5 minutes long. We call those experiences micro moments. So that's what we try to create for people, because we realize everyone has their busy life. They have a million things that they're responsible for. Oftentimes, health is not a priority for people until there's something acute. So somewhere along the journey from being healthy to having been diagnosed and dealing with the diagnosis and so on, there are always those moments, like we call them sliding doors, where you can fall off the wagon and don't, give yourself the right attention, the right care. It could be by just not knowing and doing nothing, or knowing and thinking that the problem is insurmountable, or you have other things, or whatever gets in the way of you either doing the wrong thing or doing nothing. And what we want to do is create the right experience, build those micro moments for people to do the reality check, do the education, give them tools to that health action so they stay on the right course, so they can have the best health trajectory for themselves. So what we want to do is, with Nia or her sisters, is to make sure that we cover all continuums. So if you think about Nia, she's in this population screening phase, but there are also people who are in this like symptomatic pre-diagnosis, going through diagnosis. There's so many people that get stuck and they get something abnormal and don't necessarily take it all the way through, or take too long to get fully diagnosed so they can get on treatment and so on. So definitely we want to build more along that continuum of disease progression, but also think about like all the other things that branch out.
So I love micro moments, and Techquity has such a huge opportunity because we know 80% of our health and well-being has nothing to do with clinical care. 20% has to do with being inside walls of a defined healthcare situation or experience. Micro moments empower a unique kind of access, leveraging technology that's available to everyone. And so I just love that concept of micro moments, because people have the ability to access information that can empower them on their terms, when they want it, where they feel safe, when they have time, and when they can act. And then they can revisit it. So Techquity and access walk hand in hand together. And your solutions that you're describing, Nia, Wanda, are just great examples of that. Such great examples of that. You're giving access and agency. It's just brilliant.
Thank you. That's access and agency with respect, without judgment. That's what we're shooting for.
Well, Anna, I would just like to express my gratitude to you, to the Black Women's Health Imperative, to Merck, to AdirA, for giving the communities that we serve collectively the opportunity to engage. The fact that vulnerable young Black women have a resource to go to, invite and engage and empower them in leading their healthiest lives is spectacular. So on behalf of Bellin and Gundersen Health System, whom I am employed by and loyal to and proud of, and on behalf of the Techquity for Health Coalition and Hit Like a Girl, I just want to say thank you and keep going. And I look forward to hearing in a few months and years what AdirA is up to next. So take care and thank you so much.
Thank you, Andrea, and thank you, Techquity Coalition.
Thanks for joining us as we've explored this winning Techquity case study. To learn more about the amazing work being recognized by the Techquity for Health Coalition and see all the incredible winners we've featured throughout this series, head over to the dedicated Techquity landing page on the Hit Like a Girl website. You'll find it linked in the show notes. Before you go, remember to like, follow, and subscribe to the Hit Like a Girl podcast wherever you listen. And if you've enjoyed this episode, please share it with a friend who might be interested in digital health equity. All right, thanks. See you soon.